bones here. No, not there, here. Over here. And you get this out of your mouth. That is hazardous to your health. I'm Joe Alton, MD, also known as Dr. Bones, that geezer on the go, that grump on the stump, that old man on a brand new mission, and that is to keep you and your family healthy in times of trouble. With Nurse Amy, my lovely wife, we are the authors of the Survival Medicine Handbook, a medical and first aid book that assumes there's no doctors, no hospitals, and that you are the highest medical resource left to your family. And it teaches you to be that in plain English, even if you're not a medical professional. Now, they say that old dogs can't learn new tricks. Well, this is a myth, because a little time, effort, and prodding from a very, very assertive wife has caused this old dog to do handsprings, from a mental standpoint at least. I mean, physically, let's face it. I've spent a good part of the last 4 years learning how to incorporate alternative remedies into my very conventional medical education. My medical school professors would be spinning in their graves if they knew I was into medicinal gardening, herbs, essential oils, and other hooey methods of healing. Yet in survival, the pharmaceuticals will only last so long. Those who will rebuild will need a self-sustainable way to produce substances with medicinal benefit, not even mentioning the many benefits of applying a holistic approach to patient care. Integrative medicine is a term coined by Andrew Weil, MD, in the mid-90s. It's the marriage of both conventional and alternative medicine for the purpose of using all the tools in the medical toolshed. Now, for a long time, there was no avenue for medical professionals to seek certification in this new field, somehow placing it in the status of a second-class citizenship among the medical disciplines. Now, the medical establishment has recently taken notice, however. Amazingly, the American Board of Medical Specialties has just announced the development of standards for the eventual certification of integrative medicine as a standard medical specialty. Robert Heinlein, the science fiction writer, once said specialization was for instincts. I mostly agree, but this would be a specialty that promotes generality, learning how to do surgery, set a bone, treat infections all the time while you're learning to use herbs, maybe learn acupuncture and other methods of alternative healing. This is awesome. Now, for now, this board certification in integrative medicine is only available for MDs and DOs. As such, not everyone's happy of it, as chiropractors and naturopaths and acupuncturists are left out. That is the bad part, as I believe we must unify all healers to be truly integrative. Yet, established medicine has taken a radical step by validating the methods that are employed by these practitioners. This would have been unheard of not long ago. And this is, to me, as I said before, just amazing. The new specialty board has identified its 5 principles for the FABIOM, that is the Fellowship of the American Board of Integrative Medicine. And 1, a partnership must exist between the patient and the practitioner. This is something that I have always firmly believed in. 2, there must be consideration of all factors that influence the health. That's not only the body, but the mind and the spirit. Spirituality is so important in terms of being able to get through adversity. 3, we must use both alternative and conventional methods to aid the body's healing process. Right there, buddy. 4, there must be consideration of less invasive measures when addressing disease whenever possible. This is especially important in survival because you must absolutely be concerned about the loss of supplies and things like that. So just from a practical standpoint, it's good, but also it's a good philosophy too. And 5, medical practice might be based on good science, but should be driven by inquiry and by consideration of new methods to restore and maintain health. Ever thought you'd see a stodgy medical establishment say anything like that? I didn't. So will you soon be seeing FABOIM after my name? I consider myself to be an integrative medical doctor, but it would be nice to say that I'm board certified in it. Then again, I'm about 100 years old and I have to watch myself just to make sure I don't drool on my shoes. Also, think about this. Who wants more academic letters after their name than their name has letters? I'm Joe Alton, MD, FACOG, FACS, also known as Dr. Bones, wishing you good health in good times or bad.